Hi friends, today we are going to discuss about Obsessive Compulsive disorder. I am Dr. Suresh Badadmat, Professor of Psychiatry, Head of Telemedicine Center, working at NIMANS, Bangalore. Obsessive Compulsive disorder, a chronic waxing and waning neuropsychiatric disorder, and the prevalence being 2 to 3%. If the Indian population is around 140 crore, we usually have around 3 crore population suffering from Obsessive Compulsive disorder. So it's not a small number, huge number. Unfortunately, Obsessive Compulsive disorder is very secretive disease. Many people who are suffering from illness may not know they are suffering from OCD. And many who know that they are suffering from this illness is not visible outside because the problem is inside the mind, that's inside the brain. They behave as normal as anybody else in the general population or in the public. But at home, the problem becomes more. The commonest symptoms of Obsessive Compulsive disorder are as follows. First and the foremost is obsession. Obsession is nothing but a thought or an image or urge or impulses which repeats in their mind repeatedly. They know these are all senseless, useless, time-consuming thoughts, but they are unable to stop it. It spreads over almost 24 hours. They try to resist it, but they will not be able to resist those thoughts. They are beyond their control. Though they feel that there will be some amount of relief whenever they do compulsions. So I talked about obsession. So what are those compulsions? Compulsions are some motor or other cognitive behavior which they do repeatedly to decrease these thoughts. So they are called as compulsions. Let's find what are the commonest obsessions. Commonest obsession is fear of contamination or obsessive fear of contamination. The person who gets these thoughts, they feel that everything is contaminated, dirt, infected with germs, and to remove these thoughts, they start washing their hands. The washing hands becomes so very often, they spend at least 2 to 3 hours washing. They wash till they feel satisfied. Initially, it will be around 20 minutes, 30 minutes. If they don't take treatment, the hours of duration of washing increases maybe 5 to 6 hours. There are many patients who spend their time the whole day inside the bathroom. So that is about obsessive fear of contamination. And then because of this contamination obsession, they start washing. So thought is obsessive fear of contamination, compulsion is washing. Next commonest symptom is obsessive doubts. Basically, repeated thoughts that they have not done the work properly. They have to redo it. They have a doubt whether they have locked the door properly or not, whether they have counted the money properly or not, whether they have washed the vessels properly or not, whether they have written or read properly or not. To confirm this, they have to repeat. It's not once, twice. They have to repeat many times. So we have a obsessive doubts on one hand, checking or repeating compulsions on the other hand. The next commonest symptom is aggressive obsessions. The classical is, I may do something wrong or something bad may happen to my loved ones. This is the thought which comes very frequently. The patient will say, something bad may happen to my dad. He may meet with an accident. So these kinds of repeated thoughts starts coming to their mind. Many a time the images of accidents, images of meeting with something bad happening, so these kinds of thoughts and images comes repeatedly to their mind. When these aggressive obsession do come, they start praying to God or asking for forgiveness. So that is aggressive obsession. The next commonest is sexual obsessions. These are unwanted, time-consuming, repeated sexual thoughts. Many a time images also. They don't want these thoughts because these thoughts will be directed to family members, near and dear ones, maybe same gender, maybe unknown people. So they feel disgusted. They don't get carried away by these thoughts. They feel disgusted. They want to get out of these thoughts, but they are unable to do it. Even when they go to temple, by looking at the idol, they may get sexual thoughts. Many a time they get contrast thinking or contrast thoughts. Whenever they want to pray for the God, they will get bad words towards God. Because of this, they become very depressed. they become extremely anxious because they are cursing God. Invariably, they feel that God also will punish them. So these kinds of obsessions and compulsions lead to various other coexisting disorders. The most common coexisting disorder is depression. Out of 100 OCD patients, 6 to 70% of them suffer from depression. So when we have already a challenge of obsessive compulsive disorder, now we have to treat depression together. So that means we have to deal two disorders. Obsessive compulsive disorder itself is a chronic waxing and waning neuropsychiatric disorder. Along with depression, it becomes challenging for any psychiatrist to treat. The next commonest coexisting disorder is social phobia, panic disorder, other neuropsychiatric disorders like PANDAS, that is pediatric autoimmune neuropsychiatric disorders, they are called as PANDAS. There are many other coexisting disorders may start coming. So early diagnosis and treatment is the key here. The more they delay, the more the longer duration of treatment. Invariably, any treatment, if it is started, it has to be given for months to years. Many times it may be 1 year, maybe 3 years, or maybe 5 years. The more the delay, sometimes the medication has to be taken for lifelong. This illness is not life-threatening, but it may destroy anybody's life or anybody's dream. The most usual occurrence of this illness is between 16 to 24 years, which is the most productive year of anybody's life, especially in youngsters. If we are studying, the scholastic performance starts declining very fast. The family becomes extremely anxious, they start abusing them. Most commonly we see two types of families, especially with persons suffering from OCD. Either the family will be highly critical, violent, abusive towards OCD patient, or else on the other end of the spectrum, we find the patient's family will be highly accommodative. Both are not good for patients. Basically, accommodative means if the patient is washing for 2 to 3 hours, the family members will say, I will help you out because you are washing since 2 to 3 hours, I will help you out. If they are cleaning, they will say, you don't do it, I will do it. So the family starts doing proxy compulsion instead of patients. If that is the scenario, the patient doesn't improve. They are enabling the illness. That means illness becomes more severe. So either the accommodation or criticality is not useful in OCD. The family members should be supportive. They have to make sure they come for consultation, regular consultation. They're on regular medication. They're on regular therapy. Because OCD is a treatable disorder. It has to be given medication. Without medication, obsessive compulsive disorder is very difficult to treat. One is medication, next one is cognitive behavioral therapy. Of course, family also should learn to deal with OCD, either not criticality or not enabling their OC symptoms. It has to be in the midway. Please do remember, obsessive compulsive disorder not only affects the brain, it affects the quality of life. Hence, OCD has to be early diagnosis, early treatment is the only way to go forward.